So today is the 1858th day of uninterrupted day. Sorry. Today is the 1859th, isn't it? Doctor, can you start for a while? Just a minute.
Doctor, classical homeopathy, are you doing today? Okay. Your name, yeah, you are admit, doctor. You are now co-host.
Yeah.
Sir.
It's
You
Dr.
can,
Rahul Jadhav
okay, you
here.
can do it. You can do yourself, okay?
Yes.
We can hear.
So myself, Dr. Rahul Jadhav from Satara, Maharashtra, near Pune. Hello, can you hear me?
Yeah. We can hear you.
Yeah. So first of all, thank you so much for allowing this wonderful platform where you are working tirelessly since so many, like more than 1,000. So your selfless contribution for the homeopathy is really commendable, and I am happy to be part of it. Thank you. So I think, can we start, sir?
Yes, doctor, we can.
So yes, so if you pin my screen so that it will be displayed.
Just a minute.
Yeah.
Sir, you are now co-host, that you can do it.
Okay, thank you. Myself?
Yeah, it's a case of hepatocellular carcinoma.
Correct.
Plus liver cirrhosis, isn't it, sir?
Yeah. Okay. Okay, so I have been told that I have given 1 hour. Okay. And I'm happy to tell you that I have also a small group of passionate homeopaths. We are continuously discussing case in the similar manner. We have discussed more than 50 cases, similarly, non-commercially. Just a minute. I think is it possible that my face will be at a speaker because it is looking, it is at sideline. Bindura sir, is it possible?
Yeah, you need to share your screen. And
Okay.
Are you going to start your slideshow?
Yeah. I have
Yeah,
a
after starting the slide itself, everything will be perfect.
Okay. So before that, in 5 minutes, I will tell you background. There are very esteemed, knowledgeable speakers already. He has been here. This platform is actually a golden platform where many senior homeopaths also shared their views. Today, I am here with very interesting case. So when I talked with Dr. Dhane sir, I thought that rather than telling some disease specific, I will go individualized method. That is from the single case to in depth with that case and long term follow up. Okay. So today I have a very interesting case of hepatocellular carcinoma. I will start my presentation, and before that I'll tell that there are many of our students and group members are also joining now. We are discussing this case in our group. So I'll start.
And today is the 1858th day of uninterrupted daily webinar of IFPH.
Yes, sir. Is my screen is visible?
Yeah, it's now visible. You can make it full screen if you need.
Yeah, I already did it now. Is it full screen or not yet?
Yeah, it's okay.
Like I will scroll to next slide. Let's see. Now it is full screen, or you can see.
It's full screen. Down bottom, there is another icon that we can make it more big, and we can fill the each slide to the screen itself. But no need to worry. This itself, we can do that.
More than sufficient. Thank you so much.
Yeah, it's okay. It's sufficient.
Yeah.
Let's start.
Just a minute. So this case came to me by reference of another patient who was benefited with renal problem. She was having a gross renal problem. It was somewhat improved. Then she sent this case to me. So then when this case entered in my clinic, I can see a very stout, confident woman, and she was having mainly clear diagnosis of hepatocellular carcinoma. So I welcome to all once again, and joining on this path of classical homeopathic learning. And I promise here to give you the best possible knowledge, small knowledge that I have. So this 52-year-old woman was diagnosed with hepatocellular carcinoma, segment 3 in left lobe, in the background of cirrhosis. So she was having cirrhosis since many years. Somehow it was managed, and now recently she added with this hepatocellular carcinoma. Now, because of this cirrhosis, she has all the other complications like portal hypertension, splenomegaly, and also a suspected lesion. She suffers from persistent cough, recurrent bilious headache, and vomiting, right leg pain, making her life miserable. Having been advised surgery with high risk, she sought for this alternative path. And because of the earlier patient, as I already told you. So, sir, actually what we do usually, we already share this well-documented case in our group, okay? And then student analyze it for next few, days, and then I present this presentation. So for you, those who haven't read the case, quickly, I will read the case, okay? So what you can see here is our WhatsApp group, sir. You know, different student has put their analysis of this case. Okay, now this is analysis one by one. Everyone has put. So in this way, there are more than 500 homeopaths now, and this is a case. Okay. Can you see this case?
Yes, doctor.
Okay.
Important points of the case. This is
Yeah.
the slide which is visible now.
Okay. No, I want to show you something else that was, I think I have to share it again. Now case is visible. Case details.
It's buffering. Yeah, it's shut. Yeah.
Yeah. So continuing your journey through the remarkable clinical case, we present a classical case studies September chapter. So this is what I am doing since last 1.5 years. This is a September case, but I have put it today, 2nd October, as today is the 14th anniversary of my clinic. That's why I choose today. So case continues the spirit of previous 40+ case session where we discussed case taking careful reflection, classical prescribing through improvement. Now she was diagnosed with hepatocellular carcinoma of left lobe on the background of cirrhosis. The pathology manifested in the form of loss of appetite, severe persistent cough, and has been tormenting her since more than 5 years. Frequent episodes of bilious headache, vomiting. She is fighting battle on two fronts. So one is this diagnosis, which is very unfortunate, which is very serious, and along with she was struggling with a lot of physical complaint. Now, I already told you the patient referred to me by another patient who has improved dramatically in chronic failure. Now, this lady already has consulted multiple gastroenterologists and oncologists who advised surgery for tumor removal. However, they explained that tumor was very large. We will see that if it is more than 5 centimeter, there is no direct removal or transplant is possible. Okay. So at this point, this patient came to me. Now I will study more, present you more details about this case. Okay. So first and foremost, loss of appetite, fullness, bloating, number one. Second is tormented cough. This cough issue was there since 5 to 6 years. Sudden outburst of dry cough causing weakness, breathlessness. This is second complaint. Third complaint is gastric headache. Gastric headache means she had a whole headache, forehead, triggered by weather changes, sour food, sun, heat, travel, and no major relieving factor except antacids. Usually accompanied by vomiting. Sometimes she cannot retain water. Vomiting relieves. Then we have taken all the personal histories: a desire for oily food, aversion to non-veg, aggravation by sour food, moderate thirst. She was having even thirst at night. Are you all with me? I think it is clearly visible.
Yes, doctor.
Thank you. Okay. Now probing to further. So this all information taking took almost 1 hour. Okay. Considering the seriousness of the case, I devoted more time in chronic, well-documented case. If it would have been acute, we usually don't give so much time. But for this, yes. Even we have original case record also that I will show you. Now, thermally, she was not very much clear. Ask about fanning in the cold water. She said, don't want fanning. She desire blanket. He uses warm water for bath. And there is severe headache after cold exposure. Okay. And in the hot weather, she desire fanning, avoids covering and all. So it is more or less, you can say, towards hot with the one modality, that is aggravation by cold. That is quite contradictory. Now, when I started probing mind, in front of me, the lady sitting in a calm, stable tone discussing her disease. Considering the pathology, it was not so much common. Now, there is no anxiety. In the childhood, she was in. So this is a lady who is kind of in a rural village area. She's working in the farm. Now, in the childhood, her father used to pamper her. She was very less information she was giving about childhood. Whatever it is in front of us. She didn't have work done much. She has no major disturbing memories in the childhood and got married. After marriage, it was found that husband was not very much, active, attentive, not having proper attention towards financial aspect. So she started overworking herself. Took a responsibility of entire farming issue with us. And then she had 2 sons, 1 daughter. Most of the time she spent engaged in hard work. Another concern she is mentioned is her son's divorce. But according to her, yes, that was disturbing, but that is not causing much thoughts to her. She has frequent conflict with mother-in-law also. And even she described one incident where she was very much angry. And in the fit of anger, she tried to harm herself. Okay. Then the altercation escalated to the point that she, tried to burn herself. So very much strong reaction to the contradiction and conflicts that was visible. Now, lastly, what I asked about her son. So her son said she is very punctual, concerned about work, farm, and get very angry. So hold the responsibility of the farm, especially financial aspects, are with her, and she herself work also in the farm. He said that as her liver condition progressed, she became more and more irritable. During episode of headache, she sometimes said that I don't want to live, give me something. So during pain, she was in a very unbearable condition. And she's taking responsibility, as I already told you. So this is what I have after an hour of case taking and consultation. So, Binduraji, can you see my WhatsApp?
Yes, doctor.
So that's what I was telling earlier, that this is the group where we discuss this kind of cases, and you can see student has meticulously analyzed and told their analysis like natrum sulf and all. So this is the activity that we are doing last more than 1 year. And these are the original case record that I also want to share. This is taken by a very new student. So this is about thermal, then about the headache. This is taken in Marathi. As patient told us, cough, you can see cough. Right leg pain was also very prominent. Then thermals and all. And okay, I'll like to show you a last thing from our. So this is again analysis. See, this is a way. This is a voting done by our group members. There are 500, more than 5. So they have told their analysis, right? Okay, so here I will stop this case study and go to the my PPT again. Because if the student has already studied the case, they can participate better. That was our small experience. It is like a live workshop. Okay. So here I would like to ask all the attendees, and of course my all student who has already discussing this case, what are the important point of this case that you would like to add as a first point, or something which you just can't afford to miss? We want you super active in the chat box, please. This is a session, as I have told you by organizer, just for 1 hour. So in the 1 hour, we have to, sir, when we take it as our group session, it usually lasts for 1.5 hours, 2 hours sometimes. So I would here like to ask, yes, Dr. Radhika Shembekar from Pune, she has answered pain. Definitely. See, the size of tumor is big. Okay. In a short while, we will see all the reports of this patient. So I have came to present this case with all the documentation. So we have a patient's earlier video, we have patients, all the reports, we have patients' reports after the treatment, LFT, sonography and everything. Now answers are coming. Dr. Farzana, yes. Yes, Dr. Parshuram. So everyone, please keep watch on the chat so that you will also enjoy this process of solving. Okay. The pains, everything. So from my perspective here, what is clear in front of us, the factual part. Yes, we will study the mind. Yes, Dr. Parshuram sir from Karnataka, welcome sir. We will study the mind or hopefulness and all. But what is something that we can't afford to miss is cancer affinity, cancer affection, especially the pathology right now has concentrated on the liver, right? Let's progress further. So these are the physical symptoms that you have. You have fullness, you have headache, you have right leg pain, and you have cough, right? Everybody is agree with this? Yes, please super active in the chat box that we want. Yes or no. These are the physical symptoms that is with us. Okay. So see, as a classical homeopath, we have to fight a battle on different front. You have to also look at pathology, you have to also look at physical symptom, and of course you also look at the mind. So physiology, pathology and mind, we are combining these three aspects, and then only we can say that we have done the judgment, not judgment, justice with the patient. Justice with the patient. Okay. So this you should not forget. On the one hand, you should not forget that you have cancer and liver affinity, and on the other hand, you should not forget that we have this all. Coming to the next part, we have clearly visible reports where cirrhosis is clearly mentioned. Okay. Again, moving further, this is all, bunch. If I start showing you all the reports, our session will be, end in reports only. Bunch of reports. A very challenging condition. Patient coming with this pile of reports, and everything is saying that liver cirrhosis tumor, liver cirrhosis tumor, liver cirrhosis tumor. Now, what is this? What is the problem with liver cirrhosis tumor? The tumor is so big that they just can't go to the transplant also. They can't go to the removal of tumor also. The only option left in the modern medicine is they decrease the blood supply of that tumor. They decrease the blood supply of the tumor, and this, if the tumor's blood supply is decreased, then it will shrink. So this is a line of treatment that is available. Okay. So as you can see clearly in this report, the measurements, you can see here liver, kid, gallbladder and everything. Okay. Are you all with me? Okay, please active in chat box. I will understand. So just read the impression, that is liver cirrhosis, primary portal vein with multiple channels and all moderate to gross ascites, splenomegaly and all. Okay. This is again bunch of reports. See, we will not waste time in that, but I am just trying to convey you the depth and the seriousness and of this case. That's why I present this case. reports in front of you. Okay, just keep watch on the sign of liver cirrhosis, where you can see here, if I can just on the pen. Okay, yes. So I think you can see here. Okay. So histopathology report is also with you. Next. Now, this is what I'm talking about. This is a standard treatment that is present. If the tumor is less than 5 centimeter, less than 3 millimeter, transplant is definitely possible. Rather, it is a gold standard. As soon as it passes the 5 centimeter benchmark, the transplant become more and more challenging. After 5, they give just transarterial chemoablation. In short, the arteries are ablated, means the blood supplies decrease for that tumor so that it will regress. So in our patient, the tumor is measured more than 9, placing it well beyond the Milan criteria. Outside the curative transplant and resection, conventional guidelines at this stage are just that ablation of the blood. Okay. Now, let's quickly go to the medical part, homeopathic part. So the broadest rubric that we just can't afford to miss is general cancerous affection. Well, you may say that there are more than 249 remedies, then how we can come to the one remedy. But see, as far as this precision of classical homeopathy is concerned, we have to come from the broad group of remedy to eliminating one by one to the single remedy. Again, as far as this my session is concerned, and what the way I'm practicing, learn with Dr. Amarsi Nikam sir from Pune. It is a classical what we learn and what we are practicing. Saying that we not at all devaluate or other method of curing through homeopathy. I know there are multiple ways of palliation, but I have read somewhere, most probably in the NASH, that there is little what you can achieve as much as with single remedy and minimum dose. Many homeopaths has he has written in the NASH book, in the first chapter, in the Naxomica itself, that it took me years to understand the value of this symptom, and I was routinist and prescribing aconite and belladonna in every case of fever. But after 40 years of my experience, now I can say that there is nothing that can equate a careful case taking, individualization, single remedy, and minimum dose. This you can read in the NASH Naxomica first remedy that given. Every Matramedica's author has given alphabetical remedy like abrotinum to zincum, but this NASH, being a very practical, started his Matramedica with Naxomica. I will request all the attendees to please read it once. So what I was talking, we are following the classical protocol. Not saying that this is the best, but this is the best we can do as a qualified homeopath. So first of all, this is general cancerous affection that I have taken. Now, many of our students, Dr. Suvarna, are you there? I was watching your analysis in the WhatsApp group. So many has chosen directly cirrhosis rubric. Once the patient of cirrhosis coming in front of us, either we can choose cirrhosis, we can choose atrophy, we can choose hard indurated liver, and we can choose hypertrophy. Now here, before considering mind and all, we should able to localize the pathology properly. Means we have to reflect. So a patient is coming with this bunch of report. Are you getting it? Now, out of this report, we should able to, just a minute. Sorry, there is an interruption from my side. So, Dr. Binduraji, I'm getting some reply from students that they are unable to connect. Yashasvi, what is the issue exact?
No. We can make them into all persons are in. No problem to have any connection.
Okay, so Binduraji, it is clear from our side, right?
Yeah.
So just they have to.
If they are using the link, they can sure they can join in this platform.
Yashasvi, kya issue
we can't speak. We can only do the chat box. That's the only thing we can do.
Okay, Yashasvi, try to connect from link. They are saying click on.
Yeah, it's easy. The link is open and we can do it easily.
Yes, Binduraji, what you are suggesting?
Just click on the link. No, I didn't get you. Are you saying that they can't speak now? Is that a problem with the
No, they are showing that still joining. I think Dr. Baravkar sir has many already joined from our group. Yes, I think they were putting password and all. Anyway. Parshuram Patil sir, please put on the group, our WhatsApp group, what is the exact problem, and
Now it is
please
possible. Now it is possible to enter there because there is a waiting room there.
Okay, okay.
Now I stopped it.
Okay, okay.
Now they can
Yes.
enter. Okay.
I think you also allow them.
Yeah,
apart
yeah.
from
No, no, no.
myself.
Now it is. They can immediately enter.
Okay, okay. Thank you so much. So sorry to disturb the momentum. What we were discussing was well documented case of liver cirrhosis, hepatocarcinoma. And what I was saying that if the patient is coming with nice bunch of reports, there are two things that happen to homeopaths. Some homeopaths say that we don't look it at all. We will focus only on the mind and all. And there are other homeopaths who prescribe directly pathologically, like there is liver cancer, so there is 1, 2, 3 protocol and all. As a classical homeopath, we will choose a middle path, what is taught to us by our respected Dr. Nikam sir, who runs the only 100-bedded hospital in Pune. Many of you must be aware of it. So we try to reflect that pathology of cirrhosis. Okay. Now these are options available: cirrhosis, atrophy. There is a difference between that. If we see direct cirrhosis, we come to the very small group of remedy. Okay. Now that also I will show you directly in radar in just a minute. Can you see my radar here?
Yeah.
Okay. Okay, so point what I'm saying was that if you see in the radar, cirrhosis only 7 remedies are mentioned. Okay. And even in the synthesis, that is bigger repertory, you can see not a single remedy with 3 marks, right? So if you see the author also of this, there are some new authors like even Roger Morrison. There are some old authors, but more or less. Now, if you put the word instead of cirrhosis, I will clear it and show you live. What I want to mean is atrophy. Let's see if you can see the atrophy. Okay. Is it visible now? Clearly the rubric?
Yeah.
Yeah. So you see, there are some qualified remedies, arsenic, 3 mark, 2 mark, 1 mark, meaning that here we should be aware that instead of directly jumping to the cirrhosis rubric, we should first look at all the options. Just a minute. Again, sharing my screen to the PPT. Okay. Is my PPT visible now? PPT visible now?
Yeah, it's visible. You can make it full screen if you need.
Yeah. Just a minute. Because in between, I see this.
Yeah, it's now fine.
Okay. So what I was saying that just localize the pathology. So as far as atrophy is concerned, atrophy is actually an end result of cirrhosis. So the liver is shrunken, destroyed. That's why for the atrophy, we have more remedies than cirrhosis. Okay. Cirrhosis is just scarring started. Atrophy comes last. Now, distension of liver is in earlier stages. So there are many causes like fatty liver, then there is some kind of swellings and all. And as far as hardness of liver, actually, I was going to ask each this for our students, what is the difference? But as we are running out of time, I am already telling you that there is a difference. Now, hardness is related with the consistency. Hard and shrunken can be there, and hard and big also can be there. Okay. So in this case, atrophy of the liver, that is a thing that we should not miss. The liver becomes shrunken, small, hard, which is a structural end result of cirrhosis. Now in the repertory, we often place more remedy here because atrophy is deeper final expression of disease. So I'm explaining you why atrophy, why not cirrhosis. Okay, and this is the explanation. Repertory often places more remedies here because atrophy is deeper final expression of disease, reflect more chronic destructive pathology, which many polycrest and antipsoric cover. Importance, given more remedies because it symbolizes the general state of degeneration. Okay. Now move to the further. This is a rubric that I was telling you that we can't afford to miss. Okay. Can you see it clearly? Yes.
Yes.
Now, again, if the patient is coming with confirmed liver cirrhosis, these are other expressions that you can have. You can have symptoms on the abdomen, on the skin, on the veins, on the generalities. So these are probable rubrics that you can consider on the long run. Now here, I will directly go to the repertorization because it's time is running. So this is the remedies. Don't look at the repertory analysis. I'm talking about the totality that we have taken in this: cancerous affection, atrophy, right-sided complaints, cough talking aggravation, cup swimming. So these are all uncommon symptoms. Before going to the analysis of mind, just remember that we have done the characteristic totality. Now we are entering into the terrain of the mind. Before that, I would like to show you the follow-up of this case. Okay, because you will see the body language and you can understand the patient better. To summarize it once again, patient is coming with terminal hepatic cellular carcinoma, 9 centimeter tumor, and also with the prolonged liver cirrhosis, shrunken liver. Okay. Now I will like to again stop for a while and open the live video. So actually, I have made one video of this case.
Hello, homeopaths.
Today for us,
the International Forum for Promoting Homeopathy.
I was expecting
We have
that
very
to release
interesting-
it before our session. I was in communication with Dr. Dhanesh sir. But anyway, you can see this is just 3-minute follow-up video. I will share my screen now. Can you see the video, YouTube?
Yeah.
Case to discuss. It's a case of hepatocellular carcinoma. The lady has been suffering from liver cirrhosis since long time, which turned out into the hepatocellular carcinoma. She has been to the multiple gastroenterologist and oncologist who advise her surgical intervention. After careful case taking and detailed analysis, we have given a single indicated remedy based on pathophysiology and state of mind together. And result was surprising. As you can see in the report, entire liver cirrhosis is documented to be reversed. This is
So here I would like to make it clear, we are not making any tall claim, miraculous cure or not. But sometimes with the classical homeopathy result you get is surprising to ourselves also, isn't it? When I started the treatment, my aim was never to reverse the entire cirrhosis because I know it is a scarring and all. But literally the radiologist asked that lady twice what treatment actually you are taking. He called this lady again, means once she checked his liver and found that there is no cirrhotic changes and the tumor size is also shrunken, spleen is also decreased, portal hypertension. So all these changes was surprising to the radiologist. So she asked, the radiologist asked her to wait for a while. Then after 1-2 patient, the radiologist again checked and then he given the report.
really a very surprising even to the radiologist who was investigating this lady. Let's see her live follow-up.
Now, after that, I will show the follow-up and I have put subtitle also for the other delegates who don't understand Marathi. For Marathi speaking, it is very clear.
त्याबद्दल वाटतं त्रास काय
त्रास काय नाही फक्त आता म्हणजे त्या तेलकटी खातच
So this is a follow-up. I'm asking what are the changes?
नाही.
I have 3 to 4 follow-up videos. This is the recent one. Yesterday also, I had received call from this lady. I have recorded that call also. So as I was about to present this case, and surprisingly her call came yesterday. So I was again skeptical. Normal homeopaths, we are so much anxious about the case. I thought that there is some recurrence and all, but surprisingly there was no recurrence. She was telling that it is absolutely all right and she wants the next medicine.
मी प्रमाणात खाते खाल्ल्यानंतर खूप लागते
बाकी डोकेदुखी उलटी व्हायचं तुम्हाला ते
नाही कमी आले ते पण कधी तर काय खाण्यात आलं पित्त वाढलं तर होते
जेव्हा तुम्ही मे मध्ये आलता जून जुलै ऑगस्ट आणि आता सप्टेंबर या 3 महिन्यात एकूण तुम्हाला काय फरक वाटतोय
मला भरपूर फरक पाय दुखायचा तर माझा अजिबातच नाही 15 दिवसांतच कमी आले.
So she was having severe right leg pain. It is reduced in the first 15 days itself.
तेव्हापासून नाही कधी पाय दुखला नाही.
आहे ना आणि आंबट उलट्या व्हायच्या
ते पण कमी आले.
खोकला हा 5-6 वर्षापासून आहे तुम्ही म्हटला ना
हा
The cough was tormenting her since 5 to 6 years.
लागतो
हा
आता खोकल्याचं प्रमाण पहिल्यापेक्षा किती आहे
कमी आले होते.
अजून काय त्रास होतोय का
तर नाही दुसरं काय म्हणजे तेच पित्त वाढल्यावर डोकं दुखते हे कधी करत तेवढं चिठ्ठी बी 2 महिन्यात 2-3 महिन्यात
My recurrent cough and acidity months.
तर पहिलं 15 दिवसाला महिन्याला होतं.
बरं वाटतं एकंदरीत
हा
ऑपरेशन करायचं का मग आता
नाही ऑपरेशन तर आम्ही कॅन्सर केलं म्हणतो इकडं आलं ऑपरेशन आम्ही ह्याच्यात बसवलं होतं.
For the procedure, that operation is this arterial ablation. So they have done all lab investigation. They have put into one, Maharashtra government has scheme for the costly this procedure. So they have done all the legal formalities to put this lady into that facility, but fortunately it is not required till now.
ते डॉक्युमेंट्स केले पण तरी पण नाही म्हणते पण ती शरीर आपल्याला त्याची गॅरंटी देऊ शकतो
They were not
आपण
giving any guarantee about
आणि
it.
त्रास जर कमी येत असतील तर आतून इम्प्रुव्हमेंट आता रिपोर्ट मध्ये पण आपल्याला साईज कमी दिसते काविळीचं पण प्रमाण कमी दिसतंय सोनोग्राफी मध्ये चांगला आहे आणि इथं पेशंट दिसताना पण वजन खोकला पाय दुखणं पित्त
सगळं कमी
भूक कशी आहे
बघ मी जेवते मी त्यांनाच म्हणते मला सारखं जेवायला
अरे वा
Surprisingly, what she said that I want to eat too much now. I'm getting very hungry, and hunger is means appetite is absolutely not.
पहिल्यांदा भूक कमी होती
जेवण केलं की फास झोप वाटायचं.
So she's telling that after eating she was feeling very sleepy. Can anybody tell me what is this symptom about? Feeling sleepiness after eating. Actually, this is indicate the liver pathology, sleepiness, sleep over.
जेवण थोडंच खायची ते मी जेवत नव्हतं जेवण केलं की सारखं असं झोप वाटायचं.
ठीक
आता
वाटतं
काय हा
बीपी बघायचं
आता शेतातलं हे सगळं करायचं.
जपून करा
So she is saying that I am going to farm now, doing all the work. So I told her that
घरी केलं काम काही नाही.
we have discussed more than
okay, so I had done this for today's session. I hope that it should have reached to you earlier. Anyway, okay. Now, once again, I would like to show you. Just a minute. So I think you are with the case. You are understanding the happiness of a homeopath that we enjoy sometimes while treating our cases. And that is equally surprising that sometimes we feel that, oh, what actually this classical homeopathy has power to do. What I am just about to show you, and then we will again move to the analysis, is something more about the case. Yes. So I'm sharing my screen again. So you can see 3 videos. Can you see, Dr. Binduraj sir?
Yes.
Videos. So these are 3 follow-ups. I will show you the first. See, this is what lady told me.
मला सांगा हे आपण 5 मेला सुरू केला.
First follow-up. Okay. Cough is after headache after.
5-6 वर्ष म्हणलं होतं त्यावेळी तुम्ही अधूनमधून थोडा थोडा आहे ना.
Something which was tormenting her since 5 to 6 years.
अचानक उबळ वगैरे झोपेत पण. ठीक आहे. मग त्या खोकल्यात नक्की काय बदल वाटतोय?
माझं 50% पुढे तरी 50% कमी.
So in the first follow-up, she was telling it is 50 to 60% better. That is after 15 days. And what we have just seen is the latest follow-up. So
बोलताना पण येत होता.
even talking.
बरोबर. त्याचबरोबर तुम्ही
Okay, it is a long follow-up. And lastly, this is the first consultation. This is the consultation with which patient came to me.
गाठी दाखवतेस है ना.
All the consult reports. You just see the amount of,
ठीक आहे. मला सांगा आता तुम्हाला हा 2017-18 पासून त्रास आहे है ना. सुरू कसा झाला? पहिल्यांदा काय जाणवलं तुम्हाला?
So actually, I asked everything, like how this disease started. This is just 3 minutes.
जेवलं की पोट गच्च.
Fullness after eating.
म्हणजे पहिल्यापासून तुम्ही जागेदार डॉक्टरांचं चालू दिसतंय.
These are investigations. You can see.
ह्यात सगळ्या तुमच्या तपासणी केल्या. ज्युपिटरला पण दाखवलंय काय? एकंदरीत तपासण्या तुमच्या बऱ्याच दिसत आहेत. पण हे सगळं मुख्यतः लिव्हरच्या त्रासासाठी. स्कोपी हे सगळे डॉक्टर तुम्हाला मुख्य काय सांगायचे की त्याच्यामुळे तुम्ही डॉक्टर मेन काय सांगायचे तुम्ही?
So she is telling the hepatologist is in that procedure. So she is actually telling the clear procedure, cut the arteries. Okay, so this is same follow-up, sorry, first consultation where she came with this bunch of reports. Okay, so I think this is all the discussion for the establishing, understanding the gravity. You should feel that you are sitting in my clinic, right? That's why I have taken all these efforts. Now we'll go to the repertory and all. So why I shown this video to you? My presentation is visible to you now. Analysis of mind. Hello, everyone. Just a minute. Is there an issue with some connection? Hello?
Yeah, it's only buffering. It's
yes, just a minute. Is it clearly visible now? Chat box, please.
no, it's not visible now. No, doctor.
Hello?
No.
Hello?
The screen is not visible.
Screen is not visible by myself and my voice?
Yeah, that we can see.
Okay. Yes, now you will see the screen. Now, can you see the screen?
Yeah, it's buffering.
Buffering. So why it is saying your screen sharing is paused? I will share it again. From the chat box, anybody? What's you can exactly see? Let me know.
Okay, it's clear to some.
PPT visible?
No.
Okay. Just a minute. I don't know what's happening. Yes, it will be in a while. I will just clear my screen now. Multiple screens are open already.
Might be that is the reason. And we have only 8 more minutes to go.
Yeah, I'll do it in quickly. Okay, now I'll just do one last attempt. Is it visible now? I think.
Now it's visible. Yeah.
Okay. Okay, we will put it in this mode only to save the time. Okay. So about the mind, just we will look at the mind in a few minutes so that we can conclude. So she's a fearless, hardworking woman whose life revolves around farming. That is clear. Most of the time, she spent energy in the field only. She's a mild, submissive husband, so she has took all the responsibilities. Now we can see her punctuality, anger also, a lot of anger. If the work is not done properly in the farm, then also there was a huge outburst of anger. Then, so her personality in general reflects strength, responsibility, fearlessness. You know, in all this span of time, having diagnosed with such a dreaded disease, cancer with liver cirrhosis, she was still calm, firm, but at the same time more concerned about her farm work and her family and like this. Okay, so answers are coming. Yes, Chilidonium, good answer. We will talk about that in a while. Now the rubrics. I'll go to the rubric. The rubric that I have taken. You know, on our group, many has told about remedy arsenic. Yes, arsenic is absolutely indicated in close in this case. I'll say, definitely tell you the final remedy. And Bindura sir, Dr. Dhane sir told me to take it in 2 sessions, like today one and Sunday.
Okay, that's great.
That was planned because it's like we cannot just sum up quickly. But at least you have got idea that with the classical homeopathy and single minimum dose, we have achieved something which is very inspiring to every one of us. Okay. Now, important physical symptom also that I have documented. The headache was aggravated by cold exposure. The cough was in sleep during. The head pain, vomiting, emulsion. So these are all uncommon symptoms that we just can't afford to miss in order to make totality. Now, this is a report in the follow-up that I was talking about. The liver size is normal. That is something really, surprise everyone. The tumor size is decreased. Tumor has not went away. She's in treatment from 6 to 7 months. This is after treatment of 6 months. Okay. The spleen size is decreased significantly. It was, I think, so you can see this 70 to 18 millimeter previously centimeter. It has come 5 centimeter decrease, 5 centimeter. And most importantly, portal hypertension is reduced. So now we'll go to the totality. Anyone has ideas about totality? Yes. This is very important. Totality of symptoms and analysis. Yes. Aurum Chilidonium. Last 2 minutes. Any idea about the totality? Actually, sir, I want to show a nice chart of this, which I can't locate it here. Okay, lacasis, very good. Anyone else want to? See, what is the remedy is one issue that definitely what we are focused on, but equally important is how we, approach in this case. It is not like that in every case we put one dose and patients start, celebrating. There are, it is not always rose. There are mixed thorn and roses. But if you walk on this path of classical homeopathy, sometimes they will not, miss to surprise you. Yes, very good answers coming from the doctor from Karnataka. Yes, Dr. Parshuram Patil sir. Why bryonia? Why feel that it is a bryonia? Okay, then we will conclude now. Anyway, good options. Everyone who is attending, please see. This is our team who has been, we are trained to do, classical way, that taking symptom, making totality analysis. And before that, I want to show, can you see my PPT? Just let me know quickly. Can you see my PPT?
Yes, doctor. You can see that.
Yes. So what I am going to show you now is the analysis. Yes. So please, in today's 1 hour session, this is what I want to tell you briefly. This is what we are doing as a student of Dr. Amar Nikam sir. We do analysis and we focus on all three aspects, not only pathology, not only mind, but we make a nice, balance and totality of this pathophysiology and psychology. So in this case, pathology is cancerous affection, liver, physical is headache, cough, and right leg affection, diarrhea in the morning, and mental, she's a very hardworking, industrious lady. So I will differentiate in 1 minute and then we can conclude. So if she would have been arsenic, which was a good option, first of all, arsenic become very much anxious, fearful. They can't sit in a dry, firm way. It is not arsenic. Again, the thermals are dicey here. Some of you has thought that vegetarian aspect, arsenic are vegetarian. Please note that this is a great clinical pointer, differentiated between Nux omega and arsenic. And it is given in the Clark very clearly. Arsenic has propensity towards vegetarian. Again, not like that all vegetarians are arsenic, but that's why you must have suspected arsenic. But arsenic has tremendous fear of disease, anxiety and all. Here she has become irritable. She is concerned about the work, task, duty, and the hotness and thirst at night. So obviously the remedy, this is the last 1 minute. I am concluding it. Any final words about remedy? Natrum mur. Okay, natrum mur is rare to have such an anger outburst. Okay, it can be one more of a emotional, So from our group, Dr. Shembekar ma'am, Dr. Parshuram Patil sir, and many others rightly cracking the remedy. What I have given this lady in this span of 6 months. Yes, Dr. Farzana, Nux vomica is very important, but Nux vomica, we think when it is more of a thirst less at night, there can be thirst number 1. Then there is a anger, which is even more pronounced, always there. And she's, workaholic kind of stuff. Now there is one rubric that due to the pain want to die, especially in abdominal pain or this kind of, the only remedy that was given is, yes, the remedy is, any last opinion? I'm typing the name of remedy. This is the only remedy that I have given in 6 months in the 30 potency, nothing else. Okay, so I have to differentiate this carcinosin. Carcinosin, yes, carcinosin could have been thoughts if in the later stages might be needed. Okay, but as patient is coming with right leg, see the physical manifestation also, So the only remedy used was Bryonia 30. Bryonia 30, a well-proved polycrest remedy. And this is the analysis that in front of you. I have a complete session. I have complete PowerPoint presentation of the each rubric that we will take on Sunday. If the generous organizer allow me. But this is what we have done with Bryonia. And I remember in my college days, we used to study Dubé, everyone Dubé. In that Dubé Chilidonium remedy, they have given the simple, I will show you also in just 1 minute. See, this is from Dubé. Here they have given all the differentiation that how Bryonia is there. Can you see my screen?
No, doctor. It's not visible now.
Okay. Now?
No. Oh, yeah. It started.
Yeah, this is simple differentiation. Bryonia, lycopodium, this is all related to the liver trouble, Chilidonium. In the Chilidonium chapter, it is given. So what I want to emphasize, we should not make things more complicated. There is a simple path that is given by Dr. Samuel Hahnemann, and that is again taught to us by Dr. Amartya Nikam sir. And we are just following this. And on this occasion of my clinic anniversary, I would like to present this interesting case. And again,
Thank you, doctor.
running
And
out.
we need to continue this session, and we will plan it on this Sunday itself, on 5th of this month itself. And thank you for this excellent session, which you narrated well.
Thank
And
you.
on Sunday, we will continue with more remarks. We will interact with the participants also. I thank on behalf of IFPH for this session, and I thank you all participants for being here. Okay. And
So,
see you soon.
Final one line from me, Bindura sir. I will be sharing this documented case detail with you. So please share it with those who are here, so at least they can know what process we are following. I'm not here just to tell some miraculous that we have cured liver cirrhosis. No, there is a path that is more important, that I feel. Thank you.
Thank you all. Thank you, participants. Please be here. We will be coming tomorrow. We will be here with another session, and coming Sunday we will be again continuing this session itself. Thank you. And over to Malayalam for the next session.
Thank you.
Thank you all.